and welcome back to Nutrition Science Bites. And this series, we're talking about weight-related health. And my first guest for the series is Ted Kyle. Now, Ted is really important person to listen to, I think, because he's been working in obesity policy and innovation for more than 2 decades. He actually founded an organization called ConscienHealth way back in 2009. And as a pharmacist and an innovation professional, he works with health and obesity experts for better health care, and for prevention and treatment of obesity, but all around the world. I should have mentioned that Ted is based in the USA, so we've got an international network happening tonight. He's an active member of the Obesity Action Coalition. He's serving on the National Board of Directors for 12 years as its chair. Now, that deserves a massive, massive tick, doesn't it? He advises the Obesity Society on advocacy. He consults with organisations addressing the needs of people living with obesity. And he really is a tireless advocate. And I'd encourage you to sign up for Ted's daily commentary that comes out across a range of social media called ConscienHealth. And I look forward to that arriving in my inbox every day because it helps me stay up to date with what's happening around the world. And Ted, welcome. You're doing so much across so many factors. That's why I wanted you to be the first guest in this series. So welcome.
Thank you so much. Part of the joy of doing what I do is I get to meet people like you and people from all over the world who are really very smart, and I'm constantly learning from people. So it's great.
Well, I think we're learning together, aren't we? And I'm hoping that in this episode we can share some of your insights with the world. But I wanted to start with a little bit of a history tour because if we look way back to the 1970s, 1980s, I think that was the first time like the world kind of said, the mean body weight in people is starting to go up around the world. And in the US, you were sort of, as often you do, one of the first countries leading the charge on that. And it took a long time for people to say, hey, this is actually affecting people's health. So, especially for the younger generation who were born way after the 1970s and the 1980s, what's happened? What's happened in the world that this is a global phenomenon?
Well, that's like the billion-dollar question, isn't it? And people would really like to know. And lots of people are certain they know. But the truth is, if you get the smartest scientists in the world to talk about what caused this to happen, they wind up at the end of the day scratching their head and saying, well, there are lots of possibilities, and we have many, many suspects probably interacting with each other and nudging everybody's weight higher. Broadly speaking, there are four factors that have changed. I think one, we are leading more stressful lives, and
Mm.
that stress causes weight gain. And that stress comes in many, many, many different forms. Social stress, economic stress, the stress of disparities in economic prospects, stress that causes people to lose sleep, healthy sleep patterns. The list goes on, but stress and the stressful social environment that we live in is one broad factor that is playing a role. Then there's our physical and tech environment. And people are going to the gym like they never did before, and so that 30 minutes, a few or several times a week, is not really the issue where we're at the gym. What is the issue is our lives where we're sitting in front of screens like you and I are doing right
Yeah.
now and leading rather sedentary lives. And then, our whole physical environment is built in a way so that as we move through our lives, we're not really moving that much. So that's a second sort of group of factors that's playing a role. Then you have
And
chemical and
Ted,
drug exposures.
can I just
Yeah,
jump in? Because you've already
sure.
said two factors that I think compound one another as well. So you've said the stressful lives, our sedentary environments, our tech environments. And I'm already thinking, even just talking about those kind of adds the stress. Telling people, oh, you've got to go to the gym. So they're going to the gym, but then they're stressed trying to get to the gym. So it already I can see how those two factors kind of compound one another, and we've only done two of the four.
Absolutely. And when you talk about, being stressed to get to the gym and pack more in, there's also the stress that comes from weight bias, telling people that, gee, you ought to do better and not be gaining weight like that. And if you just eat less and move more, you wouldn't. And that weight bias actually creates a bit of a vicious cycle. So you're absolutely right. So the third of these four broad categories is chemical and drug exposures. Perhaps you're reading a lot about the pro, profusion of exposures to plastic and microplastics.
Mm.
It's really all over the world, but there's also endocrine disrupting chemicals and drugs that were prescribed that estimates are in the United States that about 20% of adults are receiving drugs that cause weight gain, and that hasn't received a lot of attention. And then
Ted, and I'm
finally,
going to jump in on you again because you know, they're factors that are often not even mentioned or overlooked. I previously did interview a researcher on microplastics, and I'm happy to connect you with them. And they're doing a trial on a zero plastic diet just to see what a sense that is. And the
right.
other thing, in terms of the endocrine disrupting hormones and the drugs that weight gain, we had a consultation with our community last year. That was one of their number one concerns. You know, and they challenged us as health professionals, why aren't you helping us? You're prescribing medications that make us gain weight and then tell us not to gain weight, but not providing any help. So you've already just turned the volume up on
hmm
on those first three things. They're not even standalone, are they? They're all intersecting. Okay, so number four. What's number four?
They really do interact. You're absolutely right. And number four, and it interacts with all of them, is our food environment. And that's maybe the most obvious thing. And for many people, when they think about obesity, they think only about food causing the problem, right?
Yeah.
And I would encourage everybody to think more broadly about that food environment. It's very popular right now to think about ultra processed foods and think that that is really the whole problem with our food environment. I would challenge you to think about the possibility that really it's even broader than that. It's the social context of food. It is how food fits into our lives. And perhaps you don't do this as much in Australia, but I remember a colleague of mine in Canada said, do you remember when we used to think we could get through a meeting without food and not perish?
Wow. Yeah, yeah, that's actually that's actually true. And in fact, we were talking about recently about, you know, the prevalence of just snacks and having to carry a water bottle, and we older people going, how did we survive without carrying around a big 2 liter water bottle? You know, how did we actually get to school when they didn't exist? So yeah,
Yes,
it
and how
is
did we get
interesting.
around in cars that didn't have huge cup holders?
That's exactly right. But Ted, I think there's two aspects to what you've just said. As a dietitian, my bias is food. And when you first talked about stress, it immediately I could see in my mind the stress when people are told just eat less or eat healthier without all of exactly what you summed up, that wraparound social aspect of food, being able to procure food. Price is a big thing here in Australia as it is around the world. You know, the time it takes to, you know, be doing all those other busy things, getting to the gym, getting to whatever, running your life. And food is kind of like a hassle rather than the social part of it. So number four as food and taking the broader context, I absolutely agree.
And really that hassle versus having time in our lives gets back to stress. Is a huge part of how we experience foods. And so people start eating food that they think will make them healthy and lose sight of or lose opportunities to sit and enjoy the social construct of sharing a meal and sharing that pleasure. And food has an important function for pleasure.
Absolutely. If there was only one thing, I would think that's the most important thing to do, and that's to share the meal, the evening meal or the meal where everyone's together at your place, share that
Yep,
together. So the other
absolutely.
thing I wanted to ask you though is, so older people like us, we know that the alarm bell kind of started sounding really quietly last century, but now here in Australia and the alarm sounding loudly in all high income countries is the increased prevalence of weight related poor health. And here in Australia, we are starting to see that occurring in younger and younger people. So, do we have to care? Do we have to be worried about the fact that, we're seeing younger adults developing type 2 diabetes? It is so stressful for people. Do we just say, go away, have a nice life? Or, you know, what's the point of even raising an alarm bell on weight related health, do you think?
Well, I think you raise an important point when you say alarm bell, because we have over time, over the last couple of decades, in the US anyway, tended to catastrophize the word obesity, so much so that the condition is stigmatized. And and that catastrophization, or that sense of a crisis, really doesn't help people deal with it. What helps people deal with it is a rational, health-oriented approach to obesity, one that doesn't have that heavy connotation of blame and shame and crisis.
I really like the way you said that, a rational approach, because that does not sound stressful. Whereas as soon as you talk about that shame and blame, and I think those early alarms were more about that shame and blame. For a long time in Australia, some of the early approaches were, you must do this. Yeah, like eat healthy, you must go and exercise more. And and then that does add to the stigma and the blame. But I think stigma and blame is kind of a new discussion, certainly for people listening to this podcast. I think some health professionals have been aware that there is stigma and blame that gets in the way then of getting adequate treatment for your health. But maybe you can tell us a little bit more about that, because for some people, I think it'll be the first time they've heard the word. What? Stigma? Surely not. Surely people aren't discriminated against based on body size.
Oh my goodness. People are confronted with bias and stigma related to their body size and shape and appearance everywhere they turn. And most alarmingly, in healthcare, a lot of health professionals, really virtually every health profession, has been documented that they presume that if someone is living in a larger body, then that must mean that they are sloppy, unintelligent, non-compliant, and have terrible lifestyle habits. When in fact, there are people in large bodies who have poor diets, and there are people who live in large bodies who have impeccable diets. Obesity is a problem of physiology, not behavior.
Yeah, absolutely. And there is more recognition of that. But I think there's less understanding amongst the community members. And I think the more it's being discussed by all the professional bodies, the more that message is going to start getting passed on to the general public, and that understanding that you can't change your genetics, you can't go back and change your parents as much as sometimes you might want to. You can't change your parents, and really from that biology and genetic point of view, that would be the only way you could change your susceptibility to it, don't you think?
Oh, that's absolutely right. I'm a bit of a broken record in saying that people do not really realize it, but the uh, primary factor for whether or not you will develop obesity in the environment that we're living in is the biology that we inherited. Your genes set the table for obesity, and the environment serves it up. And then you have a choice of what to do about it. So often, so many professionals often assume that it's just the backwards of that. It's poor behavior and lifestyle habits that cause obesity. And it's simple, or in that way, flawed logic. It should be simple to solve. It's not.
That's right. And one of the important points I'll take you up on that you said then, so you've got your biology. We're in this environment that tries to force feed us or tell us that we need all of these foods that were never invented last century and we absolutely don't need. It tells us we've got to spend more time going to the gyms to get the beautiful bodies, which takes away from the time doing the more ordinary things like walking. But you said then it gets in the way of you getting the treatment that you need. But one of the challenges is that bias and stigma with accessing the right treatment. So in Australia, like the US, we have a think tank group called the Obesity Collective. There's health professionals, there's policy people, there's consumers, there's people with lived experience. But one of the really important things this group have done in the last year is make available a module on training around awareness of stigma and bias, including in healthcare. And I do think that's a little bit of an eye opener for people to realize that this think tank believes the whole world needs to understand more about stigma and bias, especially in the context of healthcare and especially in the context of healthcare professionals, so that we can facilitate what you just said, people getting the best treatment, access to the right services to improve their weight-related health.
That's absolutely right. And one of the things that I've seen because of organizations like the Obesity Collective is that greater awareness, that greater appreciation of the lived experience that people have with obesity. When I started working on this, people actually living with the condition were pretty much left out of the conversations about what to do about it, as if, well, you can't really listen to those people because they're defective. And that's so wrong. And when people have the experience of dialogue with people living with the condition, it gives them a chance to rethink some of their presumptions, some of their false presumptions about obesity, about the condition, about what brings it on and what might help to solve it.
Yeah, absolutely. Well, some of the committees that I've been on, where we have people from everywhere, all different health disciplines, people with lived experience, I actually think we get closer to strategies that might work. And it
That's right.
has been really helpful for all of us to listen to everyone's opinion rather than get on our own hobby horse. I'm absolutely biased, of course, about nutrition, but to get on the hobby horse and really try and look through other lenses. So I wanted to ask you though, because of the advantage of having your newsletter and your approach going for so long, why has it still taken so long to get to this point where it's like at least in some circles, we're all around the same table trying to look at how we can meaningfully im- improve people's weight-related health. Why has it? Like, I mean, the world's full of smart people. Why is it taking so long?
I think there are two things to think about there. One is just to say up front, it's hard. This is often described as a wicked problem.
Mm,
And a wicked problem is one that defies simple solutions and defies the solutions that seem so obvious to us. This is wickedly hard because food is really essential for our survival. Our bodies are carefully programmed with redundant systems that save us from starving to death. And when that homeostatic function of maintaining a healthy weight and protecting you against starvation goes awry, there are multiple systems that resist interventions to change it. So it's hard. And then the second thing is when you talk, and I think part of your question is why has it taken so long to come up with treatments that are actually effective that we're starting to see? And a simple answer there is that for a long, long time, people said, it's really futile. Once someone reaches a state of obesity, there's really not much we can do for them, and don't count on anything ever working. There's actually an editorial in Lancet from the 70s that said, if we're really careful, we can prevent obesity, but treatment is kind of pointless. And that's been expressed many different ways, many different times. We're learning that it's not pointless. And we're also learning that if you want to prevent health problems, really paying attention to folks who are susceptible to obesity, especially in the environment we're living in, can do a lot to prevent health problems across the population.
And I guess that's why it took so long, really, to even have those community-wide prevention programs running. And we have a number of key projects happening in Australia, and there's
Hmm.
probably been more action around effective community support programs, particularly focusing on children here in Australia, to try and prevent the development of obesity. But I think what you've just said about that, Lancet editorial from the 1970s that essentially said you can't do anything. I think that did have a trigger effect of people just giving up, and certainly, there for a long time in the health system, you were actually not allowed to see someone if they were referred just for body weight because it was
Right.
believed to be futile. So I actually think it did a disservice, and the research always takes longer and longer, to come up with effective treatment. So perhaps we can talk now then about, the light on the horizon is that finally there are medications that can, jump on the biology, so to speak, or the consequences of that, the way your appetite just drives people to regain if they do lose any weight. So what's your view on what's happening with the development of these new medications for treatment?
Well, I think we're just really scratching the surface of their potential, uh, in that actually right now, because of the way they are priced and the way that health systems erect barriers to people accessing them, uh, really relatively few people are have access to this effective treatment for obesity. But already there's a lot of speculation that once you are able to treat obesity, when people look at the purchasing patterns of people who are taking these medicines, suddenly their food purchases and food consumption behaviors change, and there are lots of people suggesting that there will be great ripple effects through the economy, through the food industry, and some people are hopeful, and I would emphasize that word hope because it's certainly at this point speculation, but they are hopeful that that will spark some changes in food systems that would favor a less obesogenic environment. Um, I think food systems that promote obesity are really not just acting on their own, but they are responding to a rising prevalence of obesity. And so food systems might prompt obesity, but the causal direction might be that as there are more people walking around with obesity, then the food system adapts and serves the needs of people with obesity, and that has knock-on effects. Well, what if we could turn that on its head? And what if those ripple effects through food systems, and food companies are already thinking about this, what if that has the effect of making subtle changes in the food environment? Lots to think about, lots to study.
Yeah, and I really hope we do see that. But here in Australia at the moment, the medications are still quite expensive. So they're now the supply is a little bit more stable, but really they're quite expensive. If you have type 2
Right.
diabetes, you're able to get semaglutide, on, subsidized by the government. But if you don't have type 2 diabetes at this stage, you're not able to, even if you have other weight-related health problems. So,
Right.
but it is the beginning of the journey, and, in time, those medications will come down. But can we just go back to your point about the food environment? I hope it does change the food environment, because really the other big change way back since the 1970s has been that pressure from food marketers to get people to buy more, to consume more, to have more
Hmm.
shelf-stable food. And,
Hmm.
like the ads always say, oh, it's your choice or whatever, or we're just giving people choice. So we have a particular chocolate biscuit in Australia called a Tim Tam. I know you have your
Hmm.
Oreos, but I look at the supermarket, I go, do we really need 12 different varieties of Tim Tams? And again, I hark back to the 1970s when I was growing up, and I grew up in a state called Queensland that's really, really hot, a bit like your southern states, a bit like Florida. And as a kid, the supermarkets were not air conditioned. So there was only a short period of time where you could even buy chocolate biscuits. Otherwise, they're a bag of melted, gooey mess. So again, this is my bias. And I honestly go, we honestly do not need more and more varieties of these type of foods. So I hope that ripple effect does send a loud message back, and that the food companies direct their efforts and their research and development to other aspects that help people actually get what they need, the nutrients they need, not just the bright coloured things in packets that you can stick on your shelf and they'll still look the same in 3 years' time.
Excellent, excellent point. And I would encourage you along those lines to think about marketing even more broadly than and you are kind of pointing to that in what you say more broadly than the advertising, because the marketing starts with the design of the food products, the packaging, the very formulation of what the food product is, so that the concept of a product appeals to people and makes them want to try it. And then the product performs in a way where they say, "Oh, I like that. I'll buy more." So there's the product, there's the pricing, there's the placement so that it's always at your fingertips. And then there's the promotion, the advertising, the in-store promotion. But often we only think about that last P of marketing. And it's really all four that play a role in the patterns of consumption.
And then
My
the other
hope would
point,
be,
sorry, no, you tell me
no,
what
go
your
ahead.
hope is, and then, okay, so what I was going to let you know, say is that the having open conversations with everyone around the table is so important, because coming back to the medication and the food, I think that is the one aspect that was kind of unexpected, but turns out to be really beneficial, and that's that concept of food noise. Because it was people who are undergoing treatment with these new medications who say, I don't notice food anymore. And so we've coined the term food noise. It's now gone around the world in terms of the way that food talks to you. For a long time,
Right.
we've always mentioned how when there's something in the back of the cupboard that you really, really love, it's like it calls your name. It's like it's a
Hmm.
siren that's luring you to come back and eat it. And people
Hmm.
with lived experience have been telling us that it actually disappears. It actually goes away. I have already done a podcast episode on that concept of food noise. So I
Hmm.
think that must be a major relief for people. It's actually making it easier, and realizing that they actually now no longer want that food. So that's an extra benefit, and perhaps a stress reducer in
Hmm.
terms of now getting treatment.
There's a whole lot of talk about food noise, and I'm glad you have an episode really going into it. Folks just published in Obesity a validated scale for actually measuring the food noise that people experience, and that's different from a craving for a specific food. It's actually these thoughts that, I'm eating lunch and all I can think about is, okay, so what am I going to have for dinner? And well, let's see, I've got this and this and this, and and it is these incessant thoughts that some people will tell you, and not everybody experiences this phenomenon of news noise, but those who do and have taken medicines where the volume is turned way down on food noise would say, you know what? If I never lost a pound of weight, just being relieved of these constant intrusive thoughts about food is a godsend. It has changed my life.
Yeah, so I think, to your point about stress, that's a really, really important factor. So, in terms then, we know there's a lot of challenges in accessing optimal weight-related health care, and whether that's medication or other strategies. What do you think needs to happen next? It seems to me like it's kind of like in this chess game, some of the key pieces are on the table, but it's like what's the next important move to make if the end goal is for people really to be able to get the appropriate treatment at the right time in their life?
I would suggest two things. One is to simply start treating obesity, real clinical obesity, like any other complex chronic disease, and provide people care and stop blaming and shaming and telling them to go away and fix it themselves. That would be a big advance, just to do what you do with any other chronic disease, cancer, heart disease, whatever. Just provide care for the disease that is based on the biology and the medical needs of people that come for care. And then, second, I think it's important to start developing smarter, more effective strategies for preventing obesity. And part of that would require us to really think through what do we mean when we say we want to prevent obesity? Because my experience is that people mean different things when they say, let's just prevent it. And there are many different ways to approach the idea of prevention with regard to obesity.
Do you want to give me a couple of examples of what the key ones would be? If you were going to start with one or two, what would you do?
Well, I would start by saying we don't really know how to practice primary prevention of obesity, but I would talk about different classical thoughts about obesity, which include primordial, where you are preventing the disease across the population, uh, irrespective of individual risk. Then there's primary prevention, where you're trying to prevent the development of obesity in populations that are at risk for it. And then there's secondary prevention, where people already have overweight or obesity, and you're looking to prevent that from progressing or producing complications. Then there's tertiary prevention, where people have advanced obesity, and you're looking to bring on a remission or prevent complications. And there's even some people that talk about quaternary prevention, which involves preventing problems that might arise from more aggressively treating obesity, right?
Yeah, there's just so much to do and so much is needed. But at the same time, I think it feels like it's a hopeful time in history, and
Yes.
getting all those players lined up around that chess so that chessboard or whatever kind of strategy we need. So Ted Carl, thank you very much for talking me today and being my guest in the first episode in this series where I'm trying to put the spotlight on obesity.
Well, Professor Collins, it is a real pleasure to finally talk to you just one to one after sort of thinking of you as my online friend halfway around the world. I have a number of friends that I've made in Australia, and it's just a real pleasure when I can interact with you. This has been a real delight.
And I'm going to say thank you again for having your newsletter out there that when it pops into my inbox, I always like to see you've got your finger on the pulse around the world, and I find that helpful in keeping up to date. And I find it helpful in challenging my thoughts and keeping me up to date as well. So I'm going to put a link to that in the show notes. So thank you again, Ted Kyle.
Thank you.